Have you ever noticed your urine turning red or the color of Coca-Cola? Hello everyone, I am Dr. Vivek Venkatramani, consultant Uro-Oncologist in Mumbai. This symptom is known as hematuria and its definition is the presence of blood in the urine which may be either gross, which can be seen by the patient, or microscopic, which is only detected on a urine test. Gross hematuria can also be associated with the presence of clots in the urine, as well as it may be painful or painless. Microscopic hematuria refers to the presence of more than 3 to 5 blood cells per field in the microscope in the urine sample of a patient. These patients are often referred to us after a routine health checkup detects the presence of these blood cells. Hematuria is a very common presenting complaint to a urologic oncologist. This is because about 3% of cases with microscopic hematuria and even up to 10% of cases where blood is visualized by the patient can be caused by urologic cancers. The vast majority of these cases are due to a benign disease, however, the most common being urinary infection, urinary stones, sometimes kidney diseases like glomerulonephritis, any local causes like infection in the penis or the surrounding skin around the vagina, contamination of the urine, certain drugs like blood thinners or anti-cancer agents like cyclophosphamide. Rarely, even long distance running or strenuous exercise may cause a temporary appearance of blood in the urine. As I said, the importance of blood in the urine is the possibility that it may be associated with urologic cancer. This is why hematuria is a symptom which must never be ignored, and you must go to the urologist to have it evaluated. How do we evaluate blood in the urine? First of all, there are a few non-invasive tests like the urine routine and microscopy. A urine culture is done to detect the presence of infection. Standard blood tests like the renal function and as well as the PSA may be indicated, especially in men above the age of 50. Prostate cancer is one of the common causes of blood in the urine, and up to 10% of recurrent hematuria may be due to prostate cancer. Following this, some imaging tests are usually done in people who do not have major risk factors, which include smoking, the age above 50, certain occupational exposures to chemicals. We do a simple ultrasound to rule out kidney stones or other common causes of hematuria. In people who have some of the risk factors for urologic cancers, a CT scan is generally indicated. This is a CT urography which shows us the lining of the kidney, the urinary tract as well as the urinary bladder. It is very sensitive to detect most causes of hematuria, and a negative CT scan has a strong predictive value that there is nothing seriously wrong. All guidelines also recommend a cystoscopy, which is a small endoscopic examination of the urinary bladder in people with risk factors and gross hematuria especially, which is hematuria which can be seen. This is because sometimes the CT scan may miss small tumors within the bladder which are then picked up on the cystoscopy. Like an endoscopy of the stomach, the cystoscopy involves the introduction of a small camera through the urinary passage, and through that we visualize the entire inner lining of the urinary bladder. This is a short procedure which can be done under local anesthesia or some sedation may be needed, and most patients are discharged home within a couple of hours. If the cystoscopy or the CT scan shows the presence of a tumor, then further treatment will be based on the findings that are noted. Like I said, the vast majority of these hematuria patients have benign causes, and usually the treatment is fairly straightforward, which includes treatment for the infections, or if there are kidney stones or ureteric stones, the treatment will be tailored to that. However, hematuria is a symptom which must never be ignored because of its association with urologic cancers, and therefore please go to a doctor if there is any suspicion of blood in the urine, whether seen by you directly or whether it's on the normal urine test. Please like, share and subscribe to my YouTube channel. Thank you.